about the immune response. It's actually pretty impressive. And obviously, we've not gone over all the details today. But we can fairly accurately state that if I were to ask you when a virus, for example, enters my skin, what cells capture the virus? What molecules do they use to sense the virus? How do they chew up the virus? What molecules do they use to display it? What do they use to go to the lymph node? What T cells recognize it? What are the molecules that the T cells use to recognize it? How do they react? What brings them back to the site of the virus, and what gets rid of the virus? You can actually describe every one of those steps in reasonably complete molecular detail. You can actually say which molecules are involved. And if you think about this, this is a pretty mind-boggling statement, that you take such a complex, multi-step reaction and you can take it apart in complete detail. So it's an extraordinary accomplishment. Then you turn around the flip side, and the people interested in clinical medicine will be particularly aware of this, and you ask, why does my friend get MS or lupus? And the answer is, I don't know. You really don't have a clue. And so this is the disconnect between how much we understand about a normal immune response and how little we understand about disease, about particularly autoimmune diseases. And so in this lecture, in the next one, that's going to be the focus. But I'm going to start by saying that if you're going to really understand autoimmune disease, the first thing you have to do, and this is true of everything we do in medicine, if you want to understand the disease, you've got to understand the normal. So the first thing we got to